Hello, everyone. I'm Gary Summers, and I'm here with my very first guest for our audio edition of Mind, Body, Soul. I'm here with Tiffany Ludwicki, and Tiffany's going to talk about some things with oral health. And Tiffany, I guess the first question. Welcome, by the way.
Hi, thank you so much for having me.
So, Tiffany, I guess we wanted to talk about myofunctional therapy, and can you just explain to everybody exactly what that is?
Yeah, so orofacial myofunctional therapy in particular is related to dysfunctions of our face, our jaw, our tongue. So it's a therapy that involves retraining between our brain and the muscles of our face. So pretty much myofunctional therapy deals with dysfunctions related to breathing, chewing, and swallowing that down the road could have massive health implications. It leads to potentially comorbidities like diabetes, sleep apnea, behavioral issues, as well as posture and energy. Pretty much the tongue is related to so many parts of our body, and myofunctional therapy deals with dysfunctions that can help, with that dysfunction.
Just explain what you mean by dysfunction. Like, a tongue dysfunction or a jaw dysfunction. Can you just elaborate a little bit? Because my people, I'm sure, don't even know what that would. And I would. First time I've ever heard of a dysfunction.
Yeah. Okay. Excellent. That's really great. It's a great question. Then I never actually thought about how to explain it, but a dysfunction can come in. How would I say? A dysfunction happens without us even knowing. It's a pattern that the tongue or the cheeks and the muscles of our face do that are abnormal. Some symptoms that we could notice when it comes to what that would look like is a tongue thrust. So when we talk, our tongue pushes forward and it actually pushes the front teeth, and it creates an open bite where our teeth may not come together. It could also be we have difficulty swallowing. We don't realize it, but when we go to swallow, it involves then changing our entire neck and face posture. It's kind of hard to explain without seeing it, I think.
What is this a hereditary thing, or is it Is it a habitual thing? Is it something that someone just gets used to and that it just continues on for a lifetime if it's not checked?
Yes, yep. It's both of those things. Hereditary in the way that our diets have changed over the last couple hundred years. We no longer eat hard food. We're not chewing our food, especially as babies. We have soft pureed food. So we're not actually getting the proper jaw function with chewing. We're not building up our bone structure in our mouth. And so our mouths are becoming smaller. And then we add allergies and environmental toxins. We're not breathing the way that we should. And then the mouth and the facial structures will then again get smaller and smaller, and it can block our airway. Our tongue is the same size, but our bones are not. So we're creating smaller and smaller mouths, making it difficult to properly use our tongue, properly breathe. And so from a hereditary, yes, but then also from an environmental and habitual place where you had mentioned initially, if we start breathing through our mouth because, let's say, we have allergies or we have a cold, then we stop using our nose for breathing, and that can create a cascade of problems down the road where our mouths actually get more narrow, and that creates more crowding of the teeth. And by creating more crowding of the teeth, our tongue doesn't have the proper position. It doesn't sit in the same place. And so then that can lead to a cascade of issues when it comes to sleeping and breathing.
That's something I never knew before. Who's it for?
Everybody. um, Basically, the best time to see somebody is early in their life. So for children, let's say,
How early?
from birth. Yes. If you have, let's say, a child who's having a problem latching, they can't breastfeed, they have reflux, and they're not sleeping properly, that is an indication that there could be some kind of a tie in their mouth or some problem with their breathing. So really we would want to start looking at those habits from a very, very young age. We generally would start to maybe treat and work on these effects when they're around 4 or 5 years old, when they're a little bit more cognitive. But it's important as soon as possible because it can help with behavioral issues and like crowding of the teeth and the need for braces. And yeah, so really noticing it at a very, very young age is best.
So, can you go over a typical protocol? For instance, if a child comes in at a certain age and you've noticed certain things, is this something that would be difficult for a young child to be able? I guess they have to adapt the way they're breathing, the way they're chewing, or like how would that work as far as kids are concerned?
Yeah, it is a long process because it's retraining habits that they have created, and that's why the younger we see them, the better. If you wait until they're 10, 12 years old, they're getting braces. Well, they've been dealing with these habits up to that point, and you have to retrain a lot more. So at a younger age, when they become able to pay attention and able to sit and do some of the techniques, that would be the time to see them. And it would involve weekly meetings at first where we do just a couple exercises with them to strengthen or stretch the lips, the cheeks, the tongue. And so there's a series of exercises that we would do, and then we progress as the muscles get stronger and correct themselves into proper habits as time goes on.
Is this a daily thing for kids? Like, these exercises? Do they do them every day? Can they do them on their own? Do they need parental supervision for stuff like that?
It is something that has to be done every day because it is a habit. It should be done 2 to 3 times a day. It's best if you have multiple kids in the family to do it together. Kids love routine and kids need routine. They need structure. So it's actually a really great opportunity for the whole family to have a moment together and work as a team on strengthening these abilities.
How many times a day?
Yeah, about 2 to 3. Yeah. You're going to get the best results if you're doing it 2 to 3 times a day.
Okay.
Yeah.
So you talked about children and kids. I'm sure you must see adults who probably may have had braces or need braces, or how would you deal with a situation when an adult comes to see you with this?
Okay. Yes, there's a lot of factors. So if I look from like a dental perspective, there's a lot of signs and symptoms that we can see. And that's when you would be referred to a myofunctional therapist. Things like your tongue, scallops on your tongue, and you may have heard your dentist or hygienist explain these to you. You might have little cracks on the baseline of your tooth. You could have grinding, clenching issues, TMJ and jaw pain, headaches upon waking, dry mouth, all of these, and obviously braces, of course, especially if you're a person that's had braces more than once. You have to wear a retainer for the rest of your life, and they say to do that because your teeth have a memory. But it's more so the fact that you're doing the same habit that has put forces on your teeth to put your teeth in those positions. So with braces, you really should also have myofunctional therapy in relation to that. So that way you actually treat the dysfunction that created the need for these braces in the first place versus just going and retreating it. So yeah, if you're definitely someone with those symptoms, myofunctional therapy would be a really great idea.
Now we've probably all heard the term sleep apnea, and of course the go-to is the CPAP machine. And of course then we've heard things about how the bacteria that builds up in those CPAP machines, and then you have to clean them, everything. Is myofunctional therapy something that could help with sleep apnea?
Yes, it very well could. The biggest thing with myofunctional therapy is that it helps strengthen and tone the muscles of the face and the neck. And a lot of times people have difficulties using a CPAP machine. And that's because they have this weakening of the muscles in the back of their throat, and it just requires more pressure to get through that. And then they end up with side effects like dry mouth, and they just don't use the CPAP machine at all. And that's really unfortunate because it is essential. If you've been diagnosed with sleep apnea and you need a CPAP machine, you really want to do that to improve your overall health. So myofunctional therapy allows people to become compliant with their use. And for those people that have mild to moderate, people that just might snore but they don't even have apneas, finding out this and treating this at a very early age can hopefully prevent the need for sleep apnea in the future, because you're dealing with the direct issue at a very early stage. So I do see people with mild to moderate, do this type of therapy.
So here's a question for the ladies out there. Myofunctional therapy good for wrinkles? Facial wrinkles?
It actually has, yes. There's, if anyone has watched Twilight, there's some actors in there that have done myofunctional therapy just to accentuate their cheekbones. It does create muscle tone in the face, and really, again, treating people at a very young age, it actually helps create a better facial structure as you age. So by doing these dysfunctions that I talked about earlier, by doing this over time, the tongue will sit in the lower jaw and it'll pull your face down, creating something called long face syndrome. It creates a longer nose, a longer face that's kind of drawn out and tired looking. But by doing this therapy at a young age, you're actually building up the tone in the face and you're creating that more square, healthy, symmetrical face. And so it does improve facial features in general. So you can get some improvement at an older age, but it's obviously best to treat younger, because that's when our bones are being formed and stuff, so you have a lot of control.
We talked about kids and adults. Any specific things for moms? You're a new mom yourself.
I am.
Congratulations.
Thank you. It's actually really funny. I have been learning breathing techniques and lifestyle changes for the last couple of years. Kids have never been on my radar, and my pediatric doctor has actually led me in this direction. I knew nothing about these issues that kids were having, and until I had my little baby girl just 4.5 months ago, I didn't realize the need for kids in the St. John's area especially to have this type of therapy and to have this type of direction and follow-up. And my doctor set me up with a craniosacral therapist, an IBCLC, so we're working together to improve the health of infants in the area, to obviously help them moving on through life. And because of that, because of my background, I was able to take this form of training and be able to incorporate it into the lives of kids and moms, because ultimately, before my baby, I really wanted to help people in their 30s to 40s. Not being a mom, I didn't really understand the need. But now, just knowing that I was focused on their lifestyle and their sleep without recognizing that the kids are keeping them up because of the kids' issues. And it's not just about treating the parent, but if I can treat the children, the parents can sleep better as well. If I can treat the husband who snores and is interrupting the mom's sleep, well then, I'm improving the mom's life as well. So it could be the mom that needs the myofunctional therapy. If we actually think about sleep apnea, going back to that, it's not a disease. It's not a disorder of, obese middle-aged men anymore. We're finding it mostly in women in their 30s that are generally healthy, but maybe have some low energy and they snore. And until recently, it wasn't actually known to be an issue. And now in myofunctional therapy, I can address these and hopefully reverse the progression. And
so you brought up a good point about obesity and sleep apnea and snoring. But as you said, there are obviously other ways of dealing with that and myofunctional therapy can certainly help with that. Tiffany, just before we go, can you just kind of focus on some of the big benefits, some things, the takeaways that people would really want to contact you as far as getting an appointment and coming in to sit down and talk to you about the symptoms that they have, the conditions that they have, and how this form of therapy can help them?
Yes, absolutely. I'll break it up into children and adults. For children, if you have a child that has had difficulty breastfeeding, if they have if they have had a very weak muscle tone, so they're really slow to sit up, slow to crawl, slow to start walking. They may have some issue with energy. If they sleep with their mouth open, if your child snores, children should never snore. They should sleep with their mouth closed. If they have their mouth open at rest, if they wet the bed up until an older age, if they tend to toss and turn and they're hanging off their bed and they're just not sleeping solidly throughout the night, those are all. Oh, and if they are starting to have behavioral issues as well, those would all be symptoms that would necessitate the need for potentially having myofunctional therapy. Now, I do work with a host of people. I work with pediatricians, like I said, IBCLC, a couple different people, so we address it from many ways. But those would be who I would want to see as people being treated at a young age. And for adults, again, if you snore, if you've had braces more than once, if you have jaw pain and headaches.
You can have braces more than once?
Oh my gosh, yes. So I'm a candidate for this. I had braces as a teenager. I had Invisalign as a young adult. My teeth moved again and I got a retainer to hold them in place. So yes, if you're somebody who has had a lot of issues, they've had jaw surgery, they've had their, let's say, teeth taken out to have braces, that's creating a smaller airway. If you're one of those candidates, then you're dealing with the dysfunction of either your tongue and your cheeks, and so I would want to see you. We can adapt, and the bodies have adapted, and not all people will need this therapy, but the thing is, we look at the whole range and we determine whether or not you would benefit. And
you've opened my eyes to some things that I never even realized existed. Again, as you're listening to this, all of Tiffany's information is there on the video. So if you have any of those symptoms that Tiffany mentioned about, certainly give her a call, and she's more than happy to help. Again, Tiffany, thanks very much for taking the time out of your day, and I wish you well with your myofunctional therapy.
Thank you very much for having me again.